Dear viewers, welcome to my video channel. I'm Dr. Olena Berezovska and I will continue our exploration of pregnancy. Do not forget to subscribe to my video channel and support me with your likes. Pregnancy is not a disease, but it puts a lot of physical and emotional stress on the woman's body. Therefore, it is unsurprising that the norm established for non-pregnant women often do not apply to pregnant women. It is precisely because of a lack of understanding or complete ignorance of these subtleties that numerous false diagnoses are made and therefore unnecessary treatment is prescribed. It is important to understand that from the moment of pregnancy to the birth of the child, the female body must perform the following functions: ensuring the normal growth and development of the fetus with the necessary amount of energy and nutrition, adapting the female body to the physiological stresses of pregnancy through the use of additional sources of energy and nutrition. In doing so, several metabolic processes must be altered to ensure better utilization of energy and substances. Thus, all metabolic and biochemical processes during pregnancy are aimed not only at the preservation and normal functioning of the mother and fetus, but also at the optimal growth and development of the fetus. Therefore, it is natural that all organs and organ system of a woman adjust to pregnancy, which means that many indicators of the female body's functioning during pregnancy will be radically different from these indicators outside of pregnancy. Let us examine the main organ system to determine what happens to a woman's body during pregnancy. Today you will learn about the adaptations of cardiovascular system. The cardiovascular system gradually adapts to pregnancy in three ways simultaneously. The heart rate increases by 120%, the heart pushes out more blood by 30-50%, and the blood volume increases by 25-50%. Look at these features and think about it. If there is such a significant difference, can the normal physiological state of a woman who is not pregnant and a pregnant woman be compared? Compensating for the load of the heart, the blood volume is redistributed and concentrated in the uterus, kidneys, mammal glands, and skin. In addition, blood pressure often decreases, especially in the second trimester, because small vessels, capillaries, expand. This is why many pregnant women experience redness of the skin and often sweat. With enlargement of the uterus, the inferior vena cava and other pelvic veins are often compressed, which can lead to low blood pressure, varicose vein, hemorrhoids, and swelling of the legs. As the amount of blood pumped by the heart increases, a heart murmur can be heard, which in most cases, like mostly 97%, is not a sign of the disease. In addition, at 12 weeks of gestational age, an increased heart rate, that is physiological tachycardia, is observed in pregnant women. By 32 weeks, the rate is increased by 120% of the basal average rate at the beginning of pregnancy. It is extremely important to distinguish physiological tachycardia in pregnancy from pathological tachycardia and not to prescribe medications that are dangerous to the health of the mother and fetus. The properties of blood also change significantly. Since the volume of blood plasma increases faster by 40-50% than the number of red blood cells by 20%, hemoglobin levels decrease and physiological anemia occurs in pregnant women. The longer the gestational period and the closer the delivery, the greater the change in the blood properties. In particular, the number of blood clotting factors increased. Some of them increases by 20-100% compared to the norm for women who are not pregnant. This is usually not dangerous, but in case of deep venous disease of legs, thrombosis or blood clots can occur. Therefore, it is very important to prescribe anticoagulants to such women in a timely manner, drugs that reduce the ability of the blood to clot and prevent blood clots. However, the highest risk of thrombosis occurs in the first 8 weeks after childbirth. The only coagulants used for pregnant women are heparin and its analogs. Other medications are contraindicated or not recommended. The number of white blood cells, leukocytes, increases during pregnancy. Many women become scared, start looking for hidden infections, take antibiotics, and try to lower their white blood cells count. The closer to childbirth, the more leukocytes detected in the results of blood tests, and the fetus can reach 9-12,000 per cubic millimeter. During labor and the postpartum period, the level of leukocyte can reach even 25,000 per cubic millimeter. The erythrocyte sedimentation reaction increases significantly as well. During pregnancy, many metabolic processes and blood chemistry change, primarily at the level of carbohydrate and fat metabolism. Sugar metabolism is covered in detail in videos of diabetes during pregnancy or gestational diabetes, so stay tuned for more of my videos to come. During pregnancy, there is also an increase in the levels of all types of fat in the blood plasma. That is, pregnancy is hyperlipidemic condition. The highest levels are observed for triglycerides, 3-4 times higher than in non-pregnant women. The amount of proteins and amino acids in the blood of pregnant women decreases owing to the increased transfer of protein substances to the growing fetus. A decrease in the concentration of proteins in the blood by 20 weeks of pregnancy changes the osmotic properties of the blood related to the pressure of fluids inside the body, leading to edema. I will discuss edema in pregnant women in another video. What happens to other organs and systems? I will discuss this in the next section. Therefore, please join my channel and see you soon.